I'm Dr. Daniel Kantor, Neurology in Real Time. I'm joined here by Dr. Don Barone, who is the director of the Neuroimmunology and MS program at Cooper Neurologic Institute at Cooper Medical School, affiliated with Rowan University in Camden, New Jersey. Thank you so much for joining us. Recently, you presented data at another meeting called ACTRIMS at the Americans Committee for Treatment and Research in MS, and you talked about digital devices. Tell me more about that.
So one of the things that I and my colleagues are interested in is the development of new ways to assess functionality in multiple sclerosis patients. The standard neurologic exam and the venerable EDSS has served us well and gotten us a long way, but we think that future progress will come from the use of digital technology doing functional assessments in multiple sclerosis patients for research and clinical purposes. So the data we presented at that meeting was really a pilot study looking at an upper extremity device, quite a simple device that involves just a grab and lift function, and it measures neuromuscular quickness and relaxation times in hundredths of milliseconds. Okay. So this type of data can give you such precise information that you can see differences in multiple sclerosis patients who even physically look normal on examination. And we compared 12 patients with 12 controls, and the control patients also used a 12-hole peg test, as did the MS patients. And the differential in finding abnormalities that were statistically significant was remarkable using this type of approach. So I do think that this is something that can be adapted to lower extremity function. We're working on that. And of course now we're looking for funding, and we're going to do larger numbers of patients, and we should be able to get going with that very soon.
So you were able to show with a novel digital device that you could do a better job of understanding the upper extremity, so the hand function of people with multiple sclerosis, than our standard. And our standard that we use in clinical trials is part of what we call the Multiple Sclerosis Functional Composite, or the MSFC. It's called the 9-hole peg test. You take those pegs out, you put them in, and then you take them out. How did your device look? What does it look like? Is it something that you put on your hand, or how does it work?
So it's something that's fixed to a table or other surface, and it looks a little bit like a big flat tuning fork. Okay. And it has sensors that will sense the grip, and then sensors that will sense the lift function. And it feeds into a computer program, and you read out the speed. What's so interesting about it is it tells you neuromuscular quickness. And neuromuscular quickness is something that depends on strength, coordination, sensory function, cerebellar function. It gives you a reading of something that assesses the global functionality of the hand in multiple modalities. It also assesses relaxation time, which tells you about spasticity in the limb, all in a simple test. So we think that these types of assessments going forward show some promise in terms of our ability to use them for clinical research purposes, and ultimately it might be applicable to the clinic. These devices are not expensive to make. It should be cost effective, and time will tell as we move forward with this type of work.
Well, Dr. Don Barone, I want to thank you so much for that type of research. It really helps us in the field to move forward. We still dealing with MS as a clinical diagnosis, and I think that's fine. Listen, 85% of what I do is take a history. Then there's another 10% that is the examination, and then 5% that are labs or MRIs or other kinds of newfangled technologies. But there are some technologies that can be helpful in that exam period. Instead of it just being feel a person's grip, and I tell you, well, I think from measuring thousands of people how this feels, we can more objectively do it. We can actually objectify what we're seeing in our patients.
Yeah, I do think so. When I work with my students and residents and fellows, one of the things I always tell them, whether you're doing research in the clinic or in a lab, what you see depends on how you look. And if we learn to look at this functionality in a very sensitive way, I think it'll be very rewarding.
Well, Dr. Barone, I want to thank you so much for joining us, and I want to thank all of you for joining us with Real-Time Neurology.